number one disability in adults is diabetes.
I'm not sure.
Muscles, bowel movements.
The major cause of disability in adults is arthritis, and the best ways to keep from having as much arthritis as you might get is keeping a healthy weight and exercising.
What health issues are related to weight?
Overweight, I would think maybe knee problems or hip problems.
Fatigue, probably joint problems, knees, back.
Arthritis and asthma.
Obesity can be associated with certain medical conditions such as hypertension, hyperlipidemia, diabetes, sleep apnea, certain cancers, gallbladder disease, as well as infertility problems in women.
Number two medical reason people miss work, in my opinion, would be allergies.
The main reason that most people miss work is the flu.
The number two leading reason why people miss work is probably fatigue.
Allergies and colds.
One of the major reasons that people miss work is an episode of back pain. Episodes of low back pain are very common. They affect about 80 to 90% of people at some point in their lifetime. It can be a simple thing like a muscle pull, or it could be something a little more serious like a disc injury or a bone injury. Often they'll resolve over time without any specific treatment. Some of the things that we can do to try to minimize the chance that we'll have an episode of back pain is to keep a healthy body weight, have good core muscle strength in your abdominal muscles and your back muscles, to eat healthy, to avoid smoking, and if you have to lift a heavy object, get help and use good biomechanics by lifting with your legs and not your back.
BMI, body mass, something.
BMI is
It's
something to do with blood pressure.
I'm not sure.
BMI is, I don't know.
BMI stands for Body Mass Index. If a patient's BMI is greater than 30, they have overall increased risk for vascular disease such as heart attacks and strokes. If a patient has a BMI greater than 40, they could possibly have decreased life expectancy of 8 to 10 years of life, which is comparable to the effects of smoking.
The leading cause of death in men.
Leading cause of death in men is probably prostate cancer.
heart attacks.
I'm not sure.
I would say maybe cancer.
Actually, the leading cause of death in men and women is heart disease. There's a lot we can do to know our risk and reduce our risk of heart disease. The first and foremost would be to maintain a non-smoking lifestyle, especially in Kentucky. This is very important. It's a major risk factor. Other risk factors that we can certainly find out by seeing a primary care physician would be our cholesterol numbers, very important in terms of longer-term risk of heart disease. Knowing our blood pressure and whether it's under good control, certainly whether or not we're diabetic. These are the things you have to see your primary care physician to know. In addition, keeping a healthy lifestyle involves a healthy diet. Diets that are low in saturated fat, low in simple sugars, that have appropriate portion and calorie control can really reduce our risk factors and long-term risk of cardiovascular disease.
What can I do to lead a healthier lifestyle?
I would recommend looking at the things you eat, the way you exercise, and how you reduce stress to help with your overall health. So I would try and buy foods that are whole foods, that you know what they're made of. So either things you've cooked from scratch or ingredient lists that you're able to read. And then I would recommend finding a way to exercise that you can really enjoy and be passionate about. Don't force yourself to go to the gym if that's not your thing. Find something that's fun for you. And then I would look at incorporating a regular stress reduction practice. So that can be a whole variety of things. It may be yoga, meditation, journaling, sitting in the sun, whatever helps you to kind of counteract some of the stress from your day.